Dear learners, I welcome you to this MOOC on Population and Society. This is the first module of week 9, and in this module, we will be discussing public health and population interface. This module will begin with an introduction to what is public health and why it is important. Then we will attempt to understand the linkages between public health and population and therefore its relevance in demography. Finally, we will take a brief account of public health in India. This module therefore aims to fulfill the following objectives: to understand what is public health and its key features, to explore the core disciplines of public health and its interdisciplinary nature, to explore the linkages between public health and population, and to take a brief account of public health in India. Dear learners, a country's population is one of the greatest resources, and the quality of this resource depends heavily on the health of the population. For example, in a family, when a person is sick, they cannot perform their day-to-day activities, including the productive and economic activities, and they might have to be dependent on their family members. This not only reduces the productivity of other family members, but it also exhausts the family's resources, which might have to be directed to the treatment and cure of the sick person. The same can be extended to a country to understand the importance of public health. The health of a population is crucial importance and a necessity for growth and development of the country as a whole. This brings us to the meaning, features, and importance of public health. Public health is concerned with enhancing the general well-being and health of the population. The public health refers to a broad range of tasks and responsibilities and occupations that will contribute to ensuring favorable health outcomes for the population. According to the World Health Organization, public health refers to all organized measures, whether it be public or private, to prevent disease, promote health, and prolong life among the population as a whole. Its activities aims to provide conditions in which people can be healthy and focus on entire populations and not just on individual patients or diseases. Thus, public health is concerned with the total system and not only on the eradication of a particular disease. So in a broader sense, we can say that any organized initiative aimed at establishing, maintaining, and enhancing health are included in the field and practice of public health. This means that any initiative that improve health, prevent and lessen and treat illness, as well as address the social and ecological determinants of health are included in the purview of public health. The history of public health predates the advancement of contemporary medical sciences. The origins of population-based focused actions to enhancing health can be traced back to Hippocrates, that is somewhere around 460 to 370 before Christ. But the field of public health really began to take shape in Europe following the Industrial Revolution, when the continent's population was seriously threatened by infectious diseases, poor sanitation, and rapid urbanization. John Snow is frequently considered as the father of public health, and he was also one of the pioneers of public health. He identified the contaminated water pump as the source of infection of cholera, and his advice led to the successful containment of the disease in London. The public health approach typically entails a number of steps, starting with defining, characterizing, and quantifying the public health issue. Next, identifying and figuring out the causative factors. Third, figuring out the preventive and mitigating measures, and lastly, putting into practice efficient strategies on a larger scale and assess the results. Therefore, public health approach begins with a problem and concludes with a solution or intervention. Accordingly, we can come to the key features of public health now. It starts with number 1, epidemiology and surveillance. Through meticulous data collection and analysis, public health continuously tracks health trends and hazards and analyzes the public health status of the population. This makes it possible to identify new problems early and implement focused interventions to contain the disease. Number 2, prevention and intervention. Rather than treating illness, the goal of public health is to avoid disease and promote well-being. This includes immunization campaigns, educational initiatives, awareness campaigns, and laws that promote healthy habits and practice. Third, health equity and social justice. In an effort to reduce health inequalities and advance social justice for all, public health advocates for fair access to necessary services and resources for the better accessibility of public health. The public health discipline addresses a wide range of public health issues, including infectious and chronic diseases, environmental health concerns, and mental health disorders. Public health also includes public health and hygiene, which are practices and policies that prevent the transmission of diseases and infections while simultaneously promoting a clean and healthy environment. In addition, public health also addresses a wide range of topics including health disparities, inequities, health system strengthening and governance, health security and preparation, health communication and education, as well as health policy and advocacy. Thus, the current practice of public health requires considering a wide range of issues that influence health and well-being. This brings us to the next section, which discusses the interdisciplinary nature of public health. The purpose of public health is to ensure that all members of the society are biologically, physically, and mentally healthy. To fulfill this broad goal, public health practitioners must have a diverse variety of disciplinary knowledge. Targeting population health improvement necessitates integrating research and intervention into a number of complementing disciplinary approaches. Working across disciplines produces rich, creative, and pertinent data for public health intervention, which is useful when executing and directing effective and beneficial health actions for populations, communities, as well as individuals. It entails accepting the complex nature of health issues and using a multi-perspective approach to understanding its multiple causes and potential interventions that are required. This brings us to some of the core disciplines of public health. We start with epidemiology. It is the study of health-related events, in particular populations, including their incidence, distribution, and determinants. It also applies the knowledge to the prevention and management of the health issues. It basically talks about 5 W's, the what, which is disease, diagnosis, or identifying the problem or health event, who, the persons or people affected or exposed to the health risk, where, the location of the event, when, the time period, and why and how of the causes, risk factors, and modes of transmission. Now, another one of the core disciplines is nutrition. It is the science of food and the nutrients and other substances and their interaction and impact in relation to health and disease. Nutrition science also includes the study of behavior and social factors that often result in food choices and food habits. Next is environmental health. This core discipline of public health draws strongly on the natural sciences. Environmental health scientists monitor the levels of contaminants in the environment and seek to understand the impact of environmental factors on health. Another one of the core disciplines is health education. It is any combination of learning experiences designed to help individuals and communities to improve their health by increasing the knowledge and influencing their attitudes. Next is behavioral science. It is a field of study which focuses mostly on human behavior. Public health experts use their understanding of decision making, human interaction, and social processes to influence individuals to make healthy decisions. Health education and behavioral sciences are quite closely interrelated, both theoretically as well as practically. Health services, administration, and management also forms another discipline which is of core importance to public health. This discipline involves planning, directing, and coordinating medical and health services for efficient utilization of resources to achieve the goals of public health. Another one of the core disciplines is biostatistics. It is the application of statistics and statistical methodologies to understand and analyze the issues of public health. Health economics, concerned with alternative uses of resources in the health services sector, with efficient utilization of economic resources such as human resource, material, and financial resources, also forms one of the core disciplines of public health. Finally, demography is also of core importance for public health. It is the study of population, especially with reference to size and density, fertility, mortality, growth, age distribution, migration, and the interaction of all those with social and economic conditions. We'll discuss these linkages between demography and public health in length in the next section. We have understood that, unlike clinical medicine, which focuses on individual patients, public health relates to population health and well-being. A population's health and healthcare needs, however, cannot be measured or supplied without first determining the population size and its characteristics, which is what demography deals with. Demography is concerned with understanding population dynamics and how populations change as a result of the interaction of fertility, mortality, and migration. This information is required for establishing the estimates about future population, the composition, and the structure, which should underpin the healthcare planning for efficient and an effective public health system. Levels of mortality and associated differences in age and cause distribution of death of a population are a subject matter of demography. The number and causes of deaths that are strongly influenced by structure and composition of a population, and this influences the provisioning and requirements of public health services. For example, the proportion of population exposed to communicable diseases, poor sanitation, poor health awareness, etc., will influence the kind of interventions to be undertaken in public health. On the other hand, the efficiency and effectiveness of public health services influences the incidence of diseases, the trends of mortality and fertility, which tends to affect the population structure and composition. In addition to these, there are many socio-economic factors like literacy and school enrollment, age at effective marriage, per capita income, employment rates, and household amenities, which also have an influence on the demographic structure, which have implications for public health sector. We can therefore say that public health priorities therefore vary from one population to another depending on the demographic features of a population. Globally, it has been seen that countries have followed a demographic transition from high levels of fertility and mortality to lower levels. These changes have resulted in improved health and well-being of the people in the form of extended longevity, that is lifespan, and considerable improvements in survival at all ages. Global life expectancy at birth has increased from 66 years in 2000 to 73 years in 2019, and healthy life expectancy increased from 58 years to 63 years. This was largely due to the gains in maternal and child health and due to the major investments and improvements in communicable disease programs such as HIV, tuberculosis, and malaria. In addition to these, improved nutrition, public sanitation schemes, and specific health initiatives have resulted in improved personal hygiene practices and better infant care. This has all contributed to a better public health amongst population, which has been observed in almost all the countries. A common thread linking most of these factors is their relationship to overall social and economic development and improvements in standards of living. Therefore, we can say that an understanding of the population characteristic is crucial for effective planning and implementation of public health practices, which inevitably results in socio-economic development of a country. This brings us to the last section of our module, where we will be discussing the public health scenario in India. At the time of independence, India's health status was one of the worst in the world. The life expectancy at birth was estimated at 36.7 years in 1951. The infant mortality rates were as high as 146 per thousand in 1951. Poor socio-economic development opportunities coupled with deadly diseases kept mortality rates also very high. However, with more and more development efforts directed towards public health, there was seen that there have been improved access to healthcare services along with improved living conditions such as food supply, housing facilities, sanitation, and hygiene. And this has led to a gradual decline in deaths from infectious diseases such as smallpox, malaria, pneumonia, tuberculosis, diarrhea, poliomyelitis, typhoid, cholera, and plague. Over a period of time, because of a decline in the deaths from these infectious diseases, we have seen that there has been an improvement in both mortality indicators as well as the life expectancy. Presently, India is undergoing a health transition, both demographically as well as epidemiologically. Demographic transition is characterized by mortality decline, natural increase in population size, fertility decline, urbanization, and population aging, whereas epidemiological transition refers to changing population patterns in terms of fertility, life expectancy, as well as the leading causes of death. In India, the growing burden of chronic non-communicable diseases, the aging population, and environmental changes which are affecting the public health are all a part of the new public health agenda. Similar to other Asian nations, India is seeing a notable shift in its epidemiology, with an increasing prevalence of chronic non-communicable diseases and a decline in deaths caused by communicable diseases. Data also indicates a decrease in proportion of infectious diseases and childhood ailments in India's overall disease burden. In terms of years of life lost, the leading causes of premature mortality at the moment are pulmonary diseases and respiratory tract diseases, neonatal illnesses, diarrhea, and ischemic heart diseases. In India, stroke, tuberculosis, self-harm, traffic accidents, and congenital deformities are among the leading causes of death. So we see that there has been a shift in the public health or causes of mortality, which has led to the epidemiological transition in India. The average life expectancy at birth in India has improved dramatically from 47.7 years in 1970 to 69.6 years in 2020, which indicates a gain of more than 2 decades. Between 1970 to 2016, Indian women's life expectancy at birth increased by 24 years. This has outpaced men's increase of 20 years. Between 1970 and 2020, the infant mortality rate at the national level fell steadily from 142 to 32 per thousand live births. The maternal mortality ratio has also dropped even more, from a high of 556 in 1990 to around 113 in 2016 and 18. This has lowered India's contribution of global maternal deaths to roughly 15%. Another feature worth mentioning while talking about the public health scenario of India is the prevalence of undernutrition, and this has been observed across states. Despite government's efforts to improve nutritional supplements during pregnancy through focused programs, 58.6% of children under 5 years old and 50.4% of pregnant women still have anemia. Concerns about nutrition are also becoming very prevalent, particularly with regards to overweight and obesity in young adults and children, especially in the cities. These can be all linked to higher risks of non-communicable diseases like hypertension, diabetes, and cardiovascular disorders. As already mentioned, the decline in infant mortality rate and maternal mortality ratio in India has been impressive. This can be attributed to increased public sector investments in the field of reproductive, maternal and child health, as well as increases in the number of coverage of frontline workers like ASHAs and ANMs. Numerous public health investments have been facilitated by flagship programs of the central government, and this includes the National Rural Health Mission. Significant progress has been made on water, sanitation and hygiene practices, which includes access to clean drinking water as well as access to toilets. The percentage of people practicing open defecation reduced from 56% to 46% between 2006 and 2016 as per WHO and UNICEF reports. The National Annual Rural Sanitation Survey 2019-20 indicates that nearly 94.4% of the households surveyed have access to toilet facility. Therefore, we can see that India has made improvements in water, health and sanitation field as well. Public health statistics in India, however, reflect social and economic inequities. Many researchers have pointed out that there is an evident association between appallingly low health status as well as the poverty, female gender, rural place of residence, tribal, ethnicity, scheduled castes, and specific minority groups. Thus, we can say that social, economic, and political systems that produce social stratification pose serious challenges to effective implementation of public health services in India, and this requires immediate attention for us to improve the public health in India and thereby facilitating the socio-economic development and growth of the country. With this, we come to the end of this module. Thank you.